Hello, Professor Letner. This is Jennifer Canela here, doing my demonstration speech for CMST 109. So today, what will we be doing? I will be showing you how to properly draw up a medication that is in the field I am in, so it's very interesting to me. So here we go. First, I'm going to introduce you to the different sizes of things that we have, and materials that I will be using. So you will need a syringe. I have 3 different syringes here. This one is a 3 cc syringe, if you can see that, hopefully. This one here is a 5. And then this one is our biggest that we have. It is a 10, but you can actually fit up to 12 cc's in there. Today we will just be doing the small one, the 3 cc. We have 3 different size needles, and I'll explain later why. So we do start off with the biggest one. This is an 18 gauge needle. If you can see through that, it's pretty big. And then we do have a 25 gauge needle here. It's not as thick, it's just a lot longer. And then we have a 27. So this one is a lot longer as well, and it's thinner. I can get this open. So we will be drawing up today's saline, which is basically just salt water, which is what I have here. This is what we will be drawing up today. And you will need an alcohol swab in order to clean this, the top of the saline. That way there's no cross-contamination or anything like that, and clean hands. I did wash my hands, and you actually do not need gloves to draw up a medication. So let's go. So we're gonna do let's do this one since it's a little bit bigger, so it might be easier for you to see. So what we're gonna do is screw on the top of the 18 gauge needle. The reason I am using an 18 gauge needle first is because most of the medication you have to draw up in the field is really thick. So if I were to use something like the 27 I showed you, it would be a lot harder and take a lot longer to draw up medication. So we always do the 18 gauge needle here where I work. It's a lot easier to draw up medication. So here's our vial. This is called a vial where our medication is in, which is our saline. So we're just gonna pop that top off with your nail and then clean with an alcohol swab just a few times in circular motion. We'll take off the lid and then go ahead and insert it. You see how big this needle is? It's humongous. And you'll flip over just like that. And you will actually just pull the flange back. This is your flange on your syringe. So just pull back and you'll see the solution kind of start going in. I don't know if you can see very well, but I do have an air bubble here. So that is unacceptable. So I can cause like an air embolism or something really dangerous with this, depending on what the medication is and where it is going in the body part. Therefore, I'm gonna have to fix it. So what I'm gonna do, since it's the same medication, is I'll go ahead and just let it go back in, try to get rid of my air bubble, and pull back once again. So let's say we're just gonna do maybe like 4. And here's my air bubble again. So let's do it again. Get rid of that. And let's try one more time. Pull back. And that looks pretty good. So then you just pull it out. And then we're gonna twist this off. Since we have already administered medication, we do not want to cover it back up with the lid. It's really dangerous to us, as we can poke ourselves with this huge needle. And we'll get rid of this in our safety containers. And now what we're gonna do is go ahead and put in the needle we're actually going to use to administer the drug. So in this case, we'll be doing the 25, which is not so big as the other one. An interesting fact about these needles is the smaller the number on a needle, it's the bigger it is. So the 27 is a lot smaller than the 25. And it's usually a lot smoother when we're administering medication, as the patient can't really feel the needle go in since it's a lot smaller. So this is what a proper draw looks like here. So this is what it should look like. No air bubbles up at the top. So it looks pretty good. And then we would just administer it to the patient. So what did we learn today? We learned how to properly draw up a medication, different syringe sizes like I showed you, different needle sizes, and the purpose as to why we use different needle sizes. I'm sure not everyone does, but there's a reason we do. And what a vial looks like, what's actually in the vial, the medication, and that's pretty much it. So thank you. I hope you enjoyed, and I hope I taught you something you didn't already know.